Hello, hello, and welcome to HealthCorps' inaugural Project Health Showcase presented by USANA Health Sciences. My name is Orlando Espino. My pronouns are he, him, and his. And I am a program supervisor for HealthCorps, and I'll be one of your hosts for today's program. Before we get started with our programming for today, I would like to start off with a land acknowledgement to honor those ancestors who have been on these lands before us. I am coming to you live from Phoenix, Arizona, and would like to acknowledge the Hohokam land I am on. If you'd like to join me by typing in your land acknowledgement, feel free to type in the chat. If you're not sure what land you reside on, feel free to go to the link in the chat and find out which Indigenous land you are on. Thank you for taking this moment with me and honoring those past, present, and future. Today is a culmination of 3 months of hard work by HealthCorps students in our Teens Make Health Happen clubs across the country who identified health needs in their own communities and developed solutions to combat them with the support of HealthCorps coordinator leads. Joining me today is my co-host, Kate Crimmins.
Thank you, Orlando. Hello, everyone. My name is Kate. My pronouns are she, her, and hers, and I'm tuning in from Greenwich, Connecticut, and would like to acknowledge the Munsee Lenape land that I am on. Like Orlando, I am also a program supervisor for HealthCorps. We are thrilled to bring you 27 projects from our Teens Make Health Happen clubs across the country who pitch their solutions to address a health need in their community. Each submitted project will be awarded $100 in Project Health funds to put their ideas into action. Today, we are excited to announce several award winners and provide $5,000 in Project Health funds to support teens who are making health happen. If you haven't already, remember there is a digital program available for everyone tuning in today, and you can access it at healthcorps.org/ph-program. You will also see this link in the chat. We are also giving away 5 prize packs today to some of today's lucky viewers. Anyone who enters a comment in the chat will automatically be entered to win. You need to be logged in on YouTube in order to chat. Stay until the very end of the program to find out if you won. HealthCorps' Project Health Showcase is made possible in part thanks to our following sponsors. Our title sponsor is longtime supporter USANA Health Sciences. Our gold sponsor is Blue Cross Blue Shield of Arizona. Our silver sponsor is Wentworth Partners. Our bronze sponsors are the Mala Family Foundation Incorporated, Hope Through Housing, Oxnard Union High School District, and WIN New York City. And special thanks to our donor level sponsor, Bloom Agency. We hope you will join us in thanking them for their support of this and other HealthCorps programs.
Joining us to kick off the event today is HealthCorps founder and chairman, Dr. Mehmet Oz.
Hi, everybody. Dr. Oz here. Thanks for joining HealthCorps' Project Health Showcase. Guys, it's been a challenging year, right? But I have so much hope for our future. You know why? Because I'm so inspired by your generation. You are compassionate, you're creative, determined, and you take an action to make health happen in your community. Today is about showcasing and celebrating the change you want to see in the world. And it starts with each of us learning about one another, observing and listening to what people around us are experiencing themselves, and then, of course, reflecting on our own experiences, our hopes, our dreams for the future. Then we got to come together with solutions and make them a reality. That's the opportunity HealthCorps offers. It's amazing to see so many young people with different backgrounds, passions, and experiences doing just that. I'm inspired by you. I really am because, and by the way, if you haven't had a chance to watch all of the Project Health submission videos yet, I really recommend it. But think about this. This is an event that we're going to be talking about for a very long time. You're watching history happen here. And I hope you look back on this year and you're proud of yourselves, the way you've adapted to new ways of doing things. And despite all the chaos, the craziness, the hardship, you've spent some time thinking about what it was that you could do to help others. And I think this year will be pivotal for the world because of you, because of your generation and those reflections. Today's event is exactly why my wife Lisa and I founded HealthCorps, to harness the power and spirit of teens to create a healthy change in communities across the country. You've demonstrated our vision in a very real and a very impactful way. I'm proud of you. So please don't stop here. Keep gaining new skills, bringing solutions to the table, and trusting that you can make a difference because you can. We are better as a community that is connected and engaged in what's happening around us. Thank you for joining us today, and I want to celebrate all of you for your hard work. I'm excited for the show. Let's check out what Teens Make Health Happen clubs have been up to this year.
Thank you to Dr. Oz for helping us open HealthCorps Project Health Showcase. Here shortly, we'll see these videos throughout our programming. And thank you to all our clubs and participants as well as the school staff and teachers who supported our students in their efforts. Now, we'd like to welcome our keynote speaker, who is a 19-year-old African-American climate justice activist, voting rights advocate, and an emerging technology developer. He's the youngest member of the White House. And I just got some news. Our keynote speaker was not able to make it. So we were going to move forward with programming and go to our next section here. So we're going to start off with, so this week we invited you to vote for your Community Choice Award. We're excited to present the top 3 finalists and give you the opportunity to vote live today for the award winner, who will receive $750 in Project Health funds. Let's take a look at our top 3 finalists.
Hi, my name is Juan, and with the help of Ayana and Alondra, current seniors of Hueneme High School in Oxnard, California, we brought together a presentation to discuss teen mental health. During this challenge, we learned just how difficult it is for some individuals to access mental health services and what we can do to help them. Our solution is to create multiple social media platforms for people to participate in, as well as read and access information on mental health services.
Hi, I'm Adriana with my partners Alejandro, Miguel, Daniel, and Juan. We're 11th graders at Hueneme High School in Oxnard, California. Our group project is based on environmental wellness, and our goal is to tackle climate change starting in our community. Our group solution is to install energy-saving light bulbs and recycling bins on our campuses and in our classrooms. My partners and I came up with the idea when we realized that schools in our union use a great amount of light bulbs throughout the classrooms. Furthermore, we came up with the idea by visualizing how recycling bins can help students and staff make better choices for themselves and the environment.
We made a website called Next Step to Success to have a central point for student resources. So we start off at the first button from the home page, which is College Hub. And in the whole College Hub, we have an easy view page. This page talks about the benefits you would have from going to college. If we scroll down a bit, we are given 2 options: academic program and picking a career pathway.
Congratulations to our finalists. You now have about 20 minutes to vote in the Community Choice Award winner. So please go to healthcorps.org/vote, which you can see on your screen or click in the chat. We will present the winner at the end of the program. So please get those votes in. Now it is time to welcome our expert panel, who will be our judges for today. Come up after the panel is an overview of the projects, more from our students, and of course, the awards for our finalists. Kate will join me as we co-host our panel.
Thank you, Orlando. It is a pleasure to welcome our special guests who, before awarding finalists, will join us to chat about health and making changes in our communities. So let's meet them. First, from the Johns Hopkins Bloomberg School of Public Health, where she is the Associate Professor and Vice Chair of Inclusion, Diversity, Anti-Racism, and Equity through the Center for Adolescent Health under the Department of Population, Family, and Reproductive Health, please welcome Dr. Terry Powell.
Our second guest won the inaugural Diversity in Medicine Scholarship, provided in tandem with the Dr. Oz Show. She's a second-year medical student at Michigan State, founded Lifestyle Fitness Empowerment, a nonprofit promoting fitness to communities without access, and an advocate for foster youth. Please welcome Michelle Walls.
Our third guest is public health analyst in the U.S. Department of Health and Human Services in the Health Resources Services Administration, where she oversees grant programs for children and youth with special health needs. Please welcome Yasi Mazlumdust. Welcome.
Our next guest is president and CEO of Big Idea Group and specializes in strategic business planning, branding and marketing, working with major names, but also smaller companies. He is also a current member of HealthCorps Board of Advisors. Please welcome James Ferguson.
Great. And rounding out our panel is a second-year MBA student at Harvard, the founder of the nonprofit Healthy Girls Save the World, a former HealthCorps coordinator, and a current member of the HealthCorps Board of Advisors. Please welcome Camille McGirt. Welcome to all of our panelists. I would love to start off by directing my very first question to you, Dr. Powell. Dr. Powell, can you share one thing that excites you about today's event and what compelled you to volunteer your time to join us today?
Yeah, thank you so much for inviting me to be on this panel. The thing that I am that I'm excited about is we live in a time where there's so many reasons to feel scared or uncertain. And watching these videos and hearing from the young people across this country just give me hope. Like, our future is in good hands, and that makes, actually our present is in good hands. Like, the work that you guys are doing today will feed over into wonderful projects moving forward. So I'm very excited about that. And I was compelled to be on this panel this morning because I live and breathe teens. Like, I am an adolescent health expert, and I do this work because there were so many people who invested in me as a teen. And I know that this is a critical transitional period going from childhood to adulthood, and anything and anytime I can support young people, I am there. So thank you.
Wonderful. Well, we are just so lucky to have you join us today. Thank you so much. And James, I'd love to hear your response as well. Why was it important you joined today?
Well, first of all, thank you very much for having me part of this amazing program. I love HealthCorps, and I've been involved with HealthCorps for many, many, many years. But most especially, I love the passion, the energy, the ideas of the youth. And I was so impressed with what I saw on the videos. I mean, that unbridled, unfiltered passion, creativity. I mean, the youth is the future of the world, of the country. And it is such a privilege to have HealthCorps as a nurturer of that. And I'm just very excited about it. I'm in the creative world, and I love working with young people because, you know what? They challenge the norm. They bring new ideas that makes us old people think so much differently. So I'm very, very excited and very impressed. But I, at the end of the day, just love HealthCorps, and we'll do anything to support it.
Oh, well, we so appreciate that. Thank you, James.
I cannot agree with you, James, as well. These kids are our future, and I'm so happy we created this opportunity for them. Next question here is directed for Michelle and Camille. Would you take a moment, reflect on your teenage lives? Okay, think about your younger selves. And so the question, I'll start off with Michelle. What kinds of community challenges were you passionate about when you were a teen? And what, if anything, did you do to be part of the solution?
You know, it's always a little difficult to answer questions about my teenage years because as a former foster youth, I was really limited in some of the activities I could be involved in. But in my later teens, when I started college, the first thing I did was try to get involved with assisting the youth coming out of foster care behind me. And so when I was about 18 or 19, you know, I often served as peer support counselors and leaders for foster youth who were trying to achieve some of the things I had achieved, which was attending college, which is rare for many foster youth.
Thank you, Michelle, for sharing your experience there. Camille, I'll ask the same question to you. What kinds of community challenges were you passionate about when you were a teen? And what did you do to be part of the solution?
Yeah. So when I was a teenager, I just remember being passionate about health. I remember when I was growing up, I'm from Durham, North Carolina, born and raised. And I remember seeing some people who lived in certain neighborhoods or who came from certain backgrounds, just had different experiences in healthcare. And I also remember like watching my mom suffer through poor interactions with healthcare providers as she battled with multiple sclerosis. And I also just kind of noticed that disease really seemed to haunt Black people in my community. And witnessing those medical woes really drove my curiosity about public health. And so as a teen, I did a lot of volunteer and service work at hospitals and clinics and just in my community to try to help understand these healthcare systems and why these disparities existed. And also when I was 19, I was an old teen, but still a teen. I completed the White House internship program, and all of you can apply for it when you're 18. But at the time, the Affordable Care Act had just been signed into legislation, and the national debate around healthcare was just palpable. And I was right there at the center of it in DC. And while I was there, I got a chance to very modestly volunteer on Michelle Obama's Let's Move campaign. And I was inspired to go back home and start a nonprofit in Durham around health equity for Black girls called Healthy Girls Save the World. But you don't have to start a nonprofit. Just giving back and being of service is more than enough to be a part of the solution.
Thank you, Michelle, Camille, for your experience and those words.
Amazing. Yes, so inspired, so inspired. With this next question, I would like to hear your perspective on teens taking charge and making community impact. So Yasi, I'm curious to hear from you. Teens sometimes question whether or not they can actually make a difference and make an impact on the world around them. What would you say to a teen that was feeling like their actions wouldn't make much of a difference? And what are some ways you've actually seen teens make a difference? And we welcome both quote unquote big or small examples.
Yeah, I would say, I mean, it's hard when you hear stories like Camille's and Michelle's, where you're like, wow, I'm so intimidated. Like, I don't know if I can do that. And so I think one thing is to think that you can start small. I think some small things that I've seen is just volunteering, helping to babysit and helping your neighbors out to be able to go to that doctor's appointment, to be able to get to their job and make money. Or just sitting at a different lunch table and starting to create friendships across lines. I feel like, virtual school aside, but when you're in person, being able to make those connections with different people and get to go outside of your comfort zone, I think is how we start to solve big problems like racism and sexism. But there's more opportunities. I think one of the coolest things that I've seen, I work on a program for epilepsy. They have an advisory council. They have experts from all across the country. I mean, these are the doctors and the researchers that everyone's quoting. And the only time I've heard that group be quiet and listen like full-heartedly to someone was when we had a 20-year-old young person who was talking about her experience with epilepsy. And it led to them being like, oh, wow, we hadn't thought about this. And they're creating all these resources and toolkits to educate other professionals just based on some of the things that she said. And I've seen, other people take charge of one young person who I know had a really terrible experience going to a healthcare center in her community. And so she got together some friends and they went and visited all the different clinics in their community and created a guide that was like, here are the teen-friendly clinics that you can go to. And so I think just that seemingly simple activity actually made a huge impact on making sure that their peers could get the healthcare they needed.
Absolutely. I love how you said those small steps really contribute to a bigger solution. So there really is no small step. Thank you for sharing.
Wonderful. Thank you. So next up here, I have a series of questions for each of you. My first question is directed to Michelle. So Michelle, being a teen can have its challenges, as we all know. We've been there. Can you describe how you not only overcame challenges in your life, but have used your experiences to propel you forward and make an even bigger impact on the community as a result?
Yes, so one of the things that really helped me overcome challenges was having blind courage. Being a former foster youth as a teen, I realized early on that there were a lot of things that people told me I couldn't do or they didn't expect from me. But I would see examples in my life where I was doing those things and I could do them. And so I kind of carried that on. And as I continue to go through life, I repeatedly have that same courage, but also I don't take no for an answer. And a lot of times people are just taken aback that you even respond again once they tell you no. And so just by that alone, they're more willing to listen and oftentimes find solutions. And of course, sometimes you got to try multiple routes and multiple ways, but just being tenacious, having that courage and not taking no for an answer.
Michelle, just a follow-up question here. What does like blind courage look like, right? We have students here who need something tangible. Like, what was there any tips you did? Like, I'll hold my breath and I counted 3 and then I went for it. Or
so thinking in teenage years, lots of things are uncomfortable, speaking up about topics that are, usually something we keep to ourselves, or speaking out loud when you're usually the quiet person. Finding ways where you can use the things you're good at and channeling them to get what you want. So if you're the funny person, you can use humor. If you know that for me, I was the honor roll student, I was the smart one. That was about it. And so I used that as much as I could to get things done.
Awesome. Thank you, Michelle. Next question here is directed to Dr. Powell. Dr. Powell, how would you describe equity? What are some examples of steps teens can take when developing solutions that help advance health equity?
Equity is the pursuit of optimal health for everyone, right? And so if we take that apart, that doesn't mean that everyone has the same health, but it means that everyone has their own best health. And I think that ways that our young people can think about how to take steps to achieve health equity is, especially for the folks who are on this call, it's really to keep doing what you're doing. Like, we first have to recognize that there's inequitable health outcomes that are happening, and really be thoughtful about why that's happening, right? Like, so often we blame people for being unhealthy or being on the negative end of health disparities. And I think instead what we might be able to do is be thoughtful about how are our programs and policies in place? In what ways are they promoting health or making it hard for other folks to retrieve optimal health? And ultimately, health equity means that not everybody will need different things to reach optimal health, right? So it's not just about equality. It's really about making sure that the folks who need the resources have the resources. And so I was so excited to hear some of the projects, because I was like, oh my gosh, you guys you get it. You get it. You recognize that there are folks by no necessary fault of their own who are not able to have optimal health. And you guys are coming up with solutions to meet that. And so I heard a quote the other day, an African proverb, if you think you're too small to have an impact, you've never spent the night with a mosquito. And so I'd like to leave all of our young people with that. Like, there's no too small thing that you can do to help others reach optimal health, or to help yourself reach optimal health. So I was, again, just fascinated by some of the projects and the innovation of the young people who are already thinking about health equity and understanding that not everybody has the same types of resources, but we can all help each other reach optimal health.
Awesome. Thank you, Dr. Powell, for those words. And the African proverb really stood out to me and connected with. I'd also like to open it to the rest of our panel here. If you have any examples or steps where teams can take away when developing solutions to help advance health equity. Anybody can jump in on this one here.
So this may not seem so much like health equity, but I think having dialogues are really important, just to really engage in conversations. I made the example of the lunch table, but just I found within my workplace, for instance, we're public health professionals, and we started a group where we meet once a month and talk about different issues, like the model minority myth among Asian American Pacific Islanders, or things like that to just really educate ourselves, because I think the more that we can talk about these issues, the more we can, as Dr. Pell mentioned, like understand the root causes of all these equity issues that we're seeing in healthcare. And we can both change the personal aspect of it, but then once we start changing the personal aspect, it's a lot easier to change those systems that reinforce these health inequities that we're seeing.
Thank you.
Yeah, one thing and addressing issues that are uncomfortable is something that I really admire, especially in the youth. The stigma around mental health is I've had my own challenges with it within our own family, and I think being bold, understanding the facts, and stopping the stigma of a lot of this type of stuff is really, really important with the facts, and being supportive to those around you and being very honest. I think I've learned a lot about that in the workplace. Sometimes people just don't like to talk about stuff, but I think transparency, honesty, being bold is really, really, really important. But one of my key things for me is this mental health, especially with pandemic and everything. I think is profound, and we really need to be supportive of everybody and stop that stigma and start the conversation. So
awesome. Thank you, James. I cannot agree more. I think mental health has impacted a lot of us, right? We've all experienced this pandemic, and a lot of that comes with trauma. So I want to remind our audience, we have about 20 minutes left for our voting, so please get those votes in. We're excited and eager to announce those finalists. So just a quick reminder, please get those votes in. So we talked about equity, health equity specifically, and mental health advocacy. So this next question is for Yasi. How would you describe advocacy, and can you describe the impact it can have on shaping public programs or policies, and how can teens be involved as advocates?
Yeah, so to me, advocacy is making the case for something that you need or something that you believe in. It can be at different levels. It can be sort of advocating for yourself in your school, in your workplace, in your healthcare provider, doctor's office. I think so. I work with families and children with special health needs, and there's a lot of talking to your providers and saying like, yeah, I need this medication, but it's affecting my ability to participate in school. Are there other solutions that we can talk to, and being involved in that conversation of advocating for yourself and what you need. But there's also the systems level, right? We know that a lot of things are like the laws and policies that we have that shape our lives. And so there's definitely opportunities, especially, regardless of your age, to go and advocate for changes that you think are really necessary. Talk to your elected official, go to lobby days, be a part of these organizations that are doing this work. I think one of the coolest examples of young people I got to work with were folks in San Francisco, and they were noticing that, we all know smoking is bad for you. And that there was more cigarettes being sold in low-income neighborhoods that had like higher smoking rates. And so they went and advocated, and yeah, it took a few years, but they talked to their local officials, they talked to local businesses and got their buy-in, and they were able to change the policy in the city to affect like who got permits to sell cigarettes, so that they weren't seeing this disproportionate prevalence in their communities.
Wow. Thank you for sharing that experience there and that research. Next up here, I have a question directed to Camille. What are examples of ways businesses and consumers can positively impact community health?
So I'd say, businesses and consumers can go into their surrounding communities and just take time to understand the health problems and the root causes of those problems by really getting to know the people that live in that area. I really loved that in some of the projects for this contest, many of you did surveys and focus groups and interviews to talk to those who would be consumers of your solution. And I really thought that was wonderful and a great way to establish trust and rapport and to ensure that the community that you're going to be working with is involved with not only really understanding the problem and plotting that out, but also designing the solution. I also love what Yazi has said about taking small steps. And so, sometimes businesses and consumers don't need to lead or start some epic act or organization. Sometimes just taking the time to understand and get to know the community around them and what their needs are and how they can support them is just in small ways is enough. So get to know the community, ask questions, and take time for really deep customer discovery. And that will help to ensure that the solution that they're creating is sticky and impactful and effective.
Thank you, Camille. I think that's a great strategy, just getting to know your community and empathizing and understanding their needs. So James, I have a question here for you. What are some practical tips you could offer to help students market and communicate the message?
It's really important with anything you do is make sure you have a very clear benefit. If you have to explain something to somebody, they're not going to get it. So work really hard in being able to communicate and in a very clear and concise manner. What is the benefit? Because at the end of the day, it's like, why do I care? What does it mean to me? Number two is understand your target market. Understand who they are. Understand what their emotions are. What are their challenges? What are they going through? So the mindset of how they can understand what the benefit is clear. The third one I would say is choose the right channel. I'm a big believer in very targeted marketing. Go where they are. Be part of the conversation. Nobody wants to be marketed to. Nobody wants to be sold anything. Be part of that conversation and be very, very authentic. And finally, and this is really important, something I've learned over years and years and years of sort of advocacy marketing, because I'm a big proponent of the 80-20 rule. You want the 20%ers who really believe in you and they will be your advocates, is make sure that your content is highly relevant, provocative, because there's a lot of noise out there, and shareable. And if you can take those three things with a very clear and a very articulate benefit through a very targeted channel to your ideal audience, you'll be successful. And the final point is never rest on your laurels. Brands, services, companies, you need to evolve, new ideas, new trends. So keep up with those things and always stay ahead of your target market in providing added value. So hopefully that's not too much stuff, but some key things.
Thank you, James. And thank you, the panel here, for those tips for our teens. I'm going to hand it over to Kate now. So Kate, back to you.
Great. Yeah, I'd love to hear. And thank you all for sharing. I don't know. I have chills. I don't know about you guys. But I'd like to open up this last question to everyone. What is one hope you have for students as they continue to impact their communities beyond this Project Health project? So if anybody would like to, we can really popcorn here. But I'd love to hear from anyone else who'd like to share.
I hope that everyone continues to be persistent, right? I know that it's been hinted at earlier, like all of the first responses won't be yes, right? So be prepared for that. Be prepared to be persistent. Continue to have passion even when others aren't sharing your passion, because that is how we get things done, right? Like there isn't really time to stop or give up, right? And especially if our pursuit is optimal health for everyone. So I hope that you stay persistent and passionate about the things that you're thinking about now, or develop new passions, right? And go toward them with the same excitement and energy that you've gone toward them with these projects.
Thank you so much, Dr. Powell.
Yeah, I love that. The other thing is never give up, ever. Ever. When you start up new ideas, etc., keep plugging along and you will be successful. And exactly what Dr. Powell is saying, keep that passion. Because honestly, if you're authentic, you believe in it, and your product or your service and what you're doing really has an impact, you will be successful. But keep the determination, never give up. Just keep going.
I agree with Dr. Powell and James. Definitely, I say when life gives you obstacles, remember that your passions can still be there, even if you have to take a break from them. That's something I always did. If I had something that set me back in life, as soon as I got back up, I would start right back up whatever I was doing and working on, and keep allowing those things to grow with you.
Thank you, Michelle. Thank you both.
Yeah, I'd say that I hope that you don't let fear get in the way, and just don't be afraid to stand up. When I was a teen, I remember there was just a lot of conformity and me feeling like if this isn't a cool thing to do, then I can't be an advocate and I can't stand up. But being honest about what I thought mattered and what I thought was important when I was a teen could have helped me to be an even better change agent. So don't be afraid to speak out and be honest about what you believe in. And I think that, if you decide that you have an idea, there's something on your heart or something on your mind that you really want to do to change your community, once you've done your due diligence. So, you've done your homework, you understand the problem, and you've created a model of what you want that solution to look like, just go. Like Nike, literally just do it. Once you start, you'll to run tests and understand if the community is attracted to what you've designed. And even if they aren't, so what? You can change your model, you can run tests and continue talking to your market and create something that'll be impactful.
Oh, excellent.
Yeah, I think I echo everything that everyone said already. I think all of those are really key. And just to sort of add on to it, that to think creatively, one, right? Like just because things are the way they are doesn't mean that they have to be the way that they are. And that, you can look at different opportunities and sort of push forward for the things that you want. And in the vein of don't give up, I think it's use your challenges. So I'm going to steal from a young advocate that I've worked with who has an illness that limits the ability that she can do things like drive a car and do all the things that she would like to otherwise do. But that because of that, it's helped her figure out what she wants to do with her life. Like that she's become this really incredible public health advocate for other people like her and really just like the field at large. And I think is going to do really amazing things in addition to all the great things that she's done. So I think having those experiences, even when they kind of suck, honestly, you can use it to create greater good.
Oh, amazing. Thank you so much. Again, chills. I'm taking all of this advice for my own personal use as well, but so inspired by this discussion. So thank you all for all your insight and for participating in this discussion. I'll pass back to you, Orlando.
Thank you, Kate. Lots of nuggets of wisdom there. I'm just going to put in my pocket just right there. So many of them. So thanks to Kate and our panelists. We will see them all very soon as we return to our awards. Reminder, the Voting for Community Choice Award is coming to a close. We will close that poll following the end of our next video. Link to vote is again in the chat, so please get those votes in. We want to announce those winners here. All right. So we had a lot of great solutions submitted from our clubs. So here's a montage of videos featuring those student teams.
The Youth Mental Health Project. Every year, millions of students suffer from mental health issues. We as a team want to primarily ensure that we are a happy and healthy generation that could work towards the best possible future.
Since we want to make a very engaging course, this will involve helping create the platform where this will be available, finding and providing resources, creating modules, and more. And second is our events. These webinars and retreats will require funding in order to plan and execute.
For our social media, we plan to spread our word through various platforms. And finally, we want to include wellness packages with items like teddy bears, cars, and more to help alleviate stress and distribute to the underprivileged community. Thank you.
There are many different cultures at our school, but we face the problem of not having enough multicultural representation. This is a problem because students on campus may not feel included or part of Rancho's community. We sent out a survey to all students and staff at Rancho to learn more about which cultures they wanted to see highlighted.
Our solution is to showcase underrepresented cultures on our campus with the culture fair in order to help students from different backgrounds feel more comfortable and represented on our campus.
Hi, my name is Danelle. I'm from Bronx, New York, and I'm in the 10th grade. The problem is the lack of feminine hygiene products available for young girls and women out there. Many people are with this issue, but it does not stop here.
We are so inspired by all of our students and their submissions, as well as our coordinators who guided them to these solutions along the way. Please make time to check these projects all out. Now it's time to bring our panelists back for the judges' review and presentation of awards for the club projects. Please welcome back Dr. Terry Powell, Michelle Walls, James Ferguson, and Camille McGirt. Our judges have all of the opportunity to see our finalists' submissions. Let's start with some thoughts overall about the videos that you've seen and what was most remarkable to you about these projects. So I'll start by asking the panel, what impressed you about these videos? Dr. Powell, I'd love to start with you. And of course, anyone feel free and jump in with your thoughts as well.
I was most impressed by the range of topics that were suggested. I mean, they went from climate change to period poverty to nutrition. So again, I am so excited. And no one person has to do all of the things, but I'm so excited. And I was so impressed that there was such a range, because again, that just gives me hope that we're all working together and we don't have to be doing the same things. Because health spans all of those areas, right? Like it spans climate change, it spans individual physical health and mental health. So that is what most impressed me, just the range of challenges that the students were trying to address and the creativity and the solutions that they had.
Absolutely, thank you. Anyone's initial thoughts, feedback, anything that impressed or stood out to you? Oh yes,
yeah,
Jane.
I'll add to Dr. Powell is the creativity. I love seeing the final product, and I think what was neat is it was well thought out. I thought the fact that a lot of folks did surveying, they thought through the implication. You can have a big idea, but if you can't execute it, it's not a big idea. So I thought that they thought through a lot of the nuances, and some were rather lofty in terms of what they wanted to do. Others were very simple, but work across all teams.
Yes, absolutely. I could not agree more. Some were very simple, straight to the point, but very thought out. It's just really great to see the variety of the presentation of these projects as well, and that creativity for sure. Would anyone else like to jump in here?
Yes, I was very inspired by the level of selflessness that all the students seemed to exude as they described the problems of their peers. I thought that was amazing, and I definitely got a dose of motivation from watching all of their videos.
And I can just say I was just really impressed by the students' passion and fervor to be innovative and to spark change in their schools and their communities. I think that this year with COVID, it's just been really hard on everybody. And the fact that you're still excited about being doers and change agents just really made my heart smile. So.
Absolutely. Absolutely. And they're all, yeah, really speaking on behalf of their peers, being those leaders to be change makers in their own community, which is amazing. I'd love to pass it back to you, Orlando.
These next question here is for Michelle and Camille. What inspired you about the students you met through their videos? So Michelle, if you want to start us off here.
Yes, I was really impressed by the level of creativity and the videography skills a lot of them showed. You know, thinking back when I was in high school, technology wasn't as advanced as it is today. And some of the things they're doing, like I'm still trying to figure out in certain areas. And so to see them mastering it as well as doing all of their studies and things that teenagers do is really impressive.
Yeah, I think that just echoing kind of what I just said a bit, you know, I'm just inspired by the students, you know, really wanting to be doers. And as one of our panelists, you know, recently said, it's not easy to come up with an idea and execute on it. Anyone can have an idea, but the fact that the students in this contest have taken this step to press the start button shows their entrepreneurial spirit and their care for the health and well-being of those around them. So their ability to just say yes to this challenge and understand the problem, form a hypothesis, devise a plan, take the time to create the deck, coordinate with each other on the speaking roles, all of that, you know, as teenagers, that's very inspiring. And I hope that you all continue to say yes and continue to be innovative.
Thank you, Michelle. Camille.
Dr. Powell, how do you think the students can grow their problem-solving abilities for the future?
Two things I'd suggest. First, really, let me back up. I think that a couple of things that all of the projects did well was to figure out, like, well, what are the end users thinking and feeling, right? So who wants to create a project that nobody wants to actually use? Like, that's a waste of everybody's time and energy. And so two ways that I would suggest, like, to grow in problem solving skills. And so, yes, definitely ask the end users, but it's also important to know what's been done already, right? Let's not recreate the wheel. Again, not a good use of time and money. Now, understanding what's already been done doesn't mean that you have to have something drastically different, but maybe there's a way to improve upon what's been done. One example that I always like to use, totally, you know, innocuous, right? We had chairs, and then somebody was like, wouldn't it be great if we put wheels on them? Yes, it would be great if we put wheels on chairs so that people can move around as they need to in their offices, even though we should be standing up. And so it's things like that, right? Like, I don't think that you need to necessarily have huge shift the paradigm, but like, how do you improve sometimes on things that are already there? And so part of that means you need to know what's already been done. The other thing that I would suggest in thinking about developing your problem solving skills is to think through the challenges, right? Be really thoughtful about what the challenges may be and how you'll, any solutions that you have to solve them, right? And I saw that as well in many of the projects. They're like, here are the challenges that we already know are coming in our way. And here's how we've already thought about how we might be able to address them, right? And I think that when you think through the challenges, you are better able to anticipate them. And the truth is, there will be challenges that you didn't anticipate, but it's okay, right? Because you've already thought through half of the one. So I think that one, recognizing and understanding what's already been done is a good tool. And then two, thinking through the challenges and proposing solutions for those challenges before you even get started. That will definitely help in the problem solving.
Absolutely. That is excellent advice. Thank you for sharing. James, I'm curious to know your thoughts on this question as well. So how can students grow their problem solving abilities?
I disappeared for about 30 seconds, but I think my internet connection went down, but I'm back in, I think. The thing for me is, in addition to obviously understanding the challenges, is always keep on top of the different trends that are going on, because everybody has their specific passion, but the world changes. Consumer needs change. So be willing to adapt, be willing to learn. And I think an idea of being humble, understand you don't know everything, okay? So be a good listener. Be a good listener to the industry experts. Be a good listener to the consumer, your target. Learn from them. And I'll tell you, it's funny, as I've worked with many brands and companies over the years, the ones that fail are arrogant. They don't listen. They're not humble. So I really would say be confident, be humble, be a good listener, and constantly be open to new ideas and opportunities, and you will naturally continue to evolve.
Amazing. Thank you so much for sharing, James. I'm curious to hear from the group. Is there any specific area in today's world that you can see teens making the biggest impact in the future?
I would definitely say with social media. You know, there are a lot of negative things that can be promoted in social media, but the way that the teens and younger generations are kind of challenging some of the negative things of the older generations and their parents and being outspoken and saying, we're not going to stand for that. It's very popular today with TikTok and Instagram and Facebook. And so I think it's powerful. A lot of it gets negative attention, but there are some great things that can come from it.
Absolutely. Absolutely.
I'd like to just piggyback onto what Michelle was saying. And not only does it, you know, like teen savviness just far like out exceeds their parents, including me. I have a teenager and I'm like, what? But it really, like, social media creates a global community, right? So the things that you're thinking about in California and Virginia, they don't have to sit in California or Virginia. They can be in South America and Asia. They can be in, you know, New Zealand. They can really be anywhere. And so I really do think that that is a privilege that we have, and that, again, agreeing with Michelle, not always, people aren't always using social media in the best ways, but like the fact that we can be a global community and really propel some of the ideas, the good ideas that are coming from our community and our young people. And you guys are leading the way, right? Like, so continue to do that and use it, you know, like the force is with you, use it with, you know, great responsibility and guidance.
Absolutely. And even just some of our students and teens that participated in this project came from our social media, and they were, you know, hooked into our Teens Make Health Happen club through our own social channels. And, you know, I'm already seeing them really use it for good and in a positive way to make change. So I think that's an excellent point. Great. Orlando, you have any other questions you'd like to address?
I think just lots of wisdom here. I just want to thank the panel again. As I hear each of you speak, I think the biggest things that stood out to me is like being authentic was a big theme here. And also taking the time to find out who you are, right? And follow those passions and just follow through and just do it, right? Like I think it was Michelle or Camille mentioned, just do it, just go for it. So thank you for that wisdom, for those words. I think we're gonna go on to our next programming here. We want to thank all our sponsors who made our clubs possible by supporting our mission. So please join me in thanking USANA Health Sciences, Blue Cross Blue Shield of Arizona, and Wentworth Partners. With their support, HealthCorps has been able to launch Teens Make Health Happen clubs across the nation and engage youth on our new social media channel, Teen Health Vibe, to bring more teens the tools to empower them. So now, I want to return to you, Kate, and the judges for the presentation of our awards.
Oh boy, thank you, Orlando. Now is the moment we have all been waiting for. It is time to present our awards. So there are 4 categories that match the pillars of our work at HealthCorps, including nutrition, physical activity, mental resilience, and community engagement, plus the important Community Choice Award. So our judges base their decisions on the following criteria: depth of understanding of the challenge, innovation in their problem solving, potential impact of project, and presentation quality. So let's get right to it. First up, we have our Best in Nutrition Award presented by Michelle.
Thank you, Kate. The Best in Nutrition Award and $500 in Project Health funds goes to The Garden Project. a project from Newcastle High School in Newcastle, Oklahoma, and coordinator Margot Burgard. Congratulations to the students' teams as listed on your screen. I'd like to turn it over to Camille, who will present the Mental Resilience Award.
Wonderful. Thank you, Michelle. So the Best in Mental Resilience Award and $500 in Project Health Funds goes to, drumroll, Youth Mental Health, a project by one of our nationwide virtual clubs with students from San Jose and San Diego, California, and Long Island, New York, led by Orlando Espino. Congratulations to the student team listed on your screen. And now I'd like to turn it over to James, who will present the Physical Activity Award.
Thank you, Camille. Best in Physical Activity Award and $500 in Project Health Funds go to, drumroll, Lunchtime Activities, a project from students at Newcastle High School in Newcastle, Oklahoma, and coordinator Margot Burgard. Congratulations. Congratulations to the students, and I'm going to turn it over to Dr. Powell, who will present the first Community Engagement Award.
Thank you, James. We are happy to announce that there's more than one winner in this category, so lots of money to go around. The first Community Engagement Award and $500 in Project Health Fund goes to, drum roll, Go With the Flow. I mean, can you think of another perfect name for period poverty? Go With the Flow is a project by students from WHAM, W-H-A-M, Bay Area in San Jose, California, led by Orlando Espino. So congratulations to the student team as listed on your screen. And now I'd like to turn it back over to you, James, who you'll present the next Community Engagement Award.
Thank you, Dr. Powell. So the next Community Engagement Award and $500 in Project Health Funds goes to 5 Days for Future, a project by students on the screen. And I'm now going to turn it over to Michelle, who will present the next Community Engagement Award.
Thank you, James. So the third Community Engagement Award and $500 in Project Health Funds goes to, drum roll, Closing the Gap, a project by students from the Healthy Teens Coalition of Manatee County and coordinator Katie Pugh. Congratulations to the student teams as listed on your screen. We will now be presenting 4 honorable mention awards. I'll pass it over to Kate.
Thank you, Michelle. The first honorable mention award is presented to a team that demonstrated a strong team commitment. This award and $300 in Project Health Funds goes to Grow With Us, a project by students from Marietta High School in Marietta, Oklahoma, and led by coordinator Tori Mathis. Congratulations to your team. Congratulations, so excited. Okay, the next honorable mention award is presented to a team that clearly defined the challenge they were aiming to solve. This award and $300 in Project Health Funds goes to Comets Care Initiative, a project by students from Aztec Charter Schools in Oklahoma City, Oklahoma, and coordinator Mariela Monjaras as the lead. Congratulations. All right, the next honorable mention award is presented to a team that spent considerable efforts empathizing with the challenge. This award and $300 in Project Health Funds goes to Period Poverty and Equitable Healthcare, a project by students from Cathedral High School in New York City and led by coordinator Tanisha Miranda. Congratulations. Oh, I'm so happy, so happy. The final honorable mention award is presented to a team that spent considerable efforts prototyping their solution. This award and $300 in Project Health Funds goes to Peer-to-Peer Wellness Card, a project by students from Rancho Campana High School in Camarillo, California, and coordinator Samantha Imisi, Kate Imisi, apologies. Congratulations, Samantha and the rest of the team. I'd like to turn it over to Orlando, who will present the Community Choice Award.
Thank you, Kate. Oh man, I'm so excited. Such great projects. And we finally have our results. The results are in. So from today's live vote, this year's Community Choice Award, if I get a drum roll, please, $750 in Project Health funds goes to Warming is Not Cool from Hueneme High School in Oxnard, California. Congratulations. Wow, I'm speechless. I'm speechless. Such great projects. So congratulations to everyone and all our winners, honorable mentions. I'm ecstatic. So let's give a shout out to all our panelists. Thank you for being here, and judges for joining us today. We appreciate you being vulnerable and sharing your experiences. Lots of nuggets of wisdom. Additionally, thank you for bringing your diverse fields to inspire students while sharing your unique perspectives and being part of our community. So thank you again, panelists and judges. Next up, we have a video for you, so hang on tight, grab some popcorn, and here's the
work
video.
on something that they're so passionate about. They have worked so hard for this project, and also the passion that they have to make positive changes in the community has just been absolutely amazing.
It's been a pleasure to get to see them grow and learn and think about problem solving for issues within their community. They've had the opportunity to use empathy to see the problem from other people's perspective and think of solutions that can meet the community's needs.
I've enjoyed supporting these teens who are making health happen, as it has given them the opportunity and the structure to create lasting change in their community. As positive role models, these teens are mentors and student leaders who provide a variety of opportunities to learn more about and engage in overall wellness while creating real connections with student and staff.
I've gotten to walk with them through a 12-week journey where they've been able to strengthen their critical thinking skills, their ability to think about their communities, their ability to use their strengths, and their ability to not only come up with and be able to recognize problems, but also be able to bring solutions.
It brings me great joy to see my students work to improve their own lives and those of their friends and the community they love so much. I hope you enjoy their projects as much as I have.
Thank you to all our club leaders for their participation in our thank you video and helping us inspire our students to be leaders in their own communities, and for facilitating these important conversations with your group members along the way. We also want to thank all our teams for their submissions and congratulate them on the work they did on their projects. It is our hope that all the teams will be able to implement their solutions to make their community a healthier place. So don't think we forgot about all of you who have been participating in the chat. As promised, we have also selected our winners from those of you who've been engaged and participating throughout the program. So if you hear your name, please email us at info@healthcorps.org and put Project Health Winner in the subject line so we can get your prizes sent out to you. Our winners are Dream LC, Amandine Louise Charles, Kitty Pop 777, Cheyenne Lawson, and Dylan Desire. Please refer to our chat for the winners and instructions detailing how to claim your prizes. Reminder, those winners I just listed will need to email us at info@healthcorps.org and put Project Health Winner in the subject line so we can get those prizes sent out to you. Congrats. And thank you for engaging. So next year, Teens Make Health Happen will be returning with more clubs and more students across the country. Learn more or sign up your school by visiting www.healthcorps.org/TMHH. You'll also find this link in the chat. So we look forward to sharing the success of the projects awarded today with you as soon as their solutions are set in motion. Reminder for those of you who are joining the VIP session after this event to please refer to the link in your email invitation at the end of this broadcast to join us for some more conversations and opportunity to network with your peers, club leaders, and health and wellness professionals. We hope to see you there.
Wow, what an inspiring showcase. I don't know about you all, but I'm definitely feeling very hopeful for our future with these wonderful change makers we saw today. Thank you to our expert panelists and to you, our lovely audience, for being here and supporting our students here. Congratulations again to all our teams for their fabulous work on their health projects. We wish everyone a wonderful summer break and look forward to seeing you all again in the fall. Remember, stay tuned. We have a VIP. I'll see you there.